Good afternoon, ladies and gentlemen. It is my great honor to give this presentation with the name Innovations in Immunoassays, Transforming Diagnostic Capabilities in India with Mindray CLIA Solutions. My name is China from Mindray, and today I will take around 15 minutes to share something new of Mindray CLIA Solutions. So let's start the journey to explore more. And my presentation include two parts: Mindray CLIA analyzer family and Mindray CLIA solution and innovations. So, okay, for the first session, I would like to share with you more information about the entire family of Mindray CLIA analyzers and the innovations utilized on them. Our CLIA analyzer family includes a variety of different analyzers that are designed to meet the needs of different types of labs, from small clinics and hospitals to large reference and chain labs, making it versatile and adaptable to the range of laboratory settings. It could be compact and efficient for small and decentralized labs. It also could be ideal for high volume and complexity labs. So we'll dive into the portfolio from the right upper corner TLA to the benchtop units. For Tier A solution, we have two different lines, M6000 and the TM8000. Both of them combine of pre-analytical, analytical, and post-analytical parts, like sample input, transportation, dispenser, decapper module, etc., etc. Well, for analytical part, not only could immunoassay and chemistry be connected, but also hematology, coagulation, and urine analyzers. Until now, there are more than 100 MT8000 lines installed in China, and which accounted a big market share. We also have integration system for big sized lab. It can help streamline laboratory operations, improve efficiency, and ensure accurate and reliable test results by integrating chemistry and immunoassay different modules together. The latest version of integrated analyzers are M680, M980, and M1000, and we call them 3M new platforms. They reflect the high throughput and intelligence simultaneously, which are utilizing full scene sampling track and ultrasound vortex mixing technology. So what are the full scene sampling and ultrasound vortex mixing technology? Based on the analysis of abnormal characteristics of a large number of data during sampling, for example, static abnormality, bubbles, clots, the analyzer can distinguish the abnormal samples to ensure the accuracy of sampling. So thanks to this new technology, it can help identify sample containers based on the databases and algorithms. It can also help improve the accuracy of sample aspiration and eliminate the risk of samples and reagent bubbles, which ensure more accurate test results. Ultrasonic vortex mixing is one of the innovations of our CLIA platforms. Most of the analyzers are using the old mixing method, like just shaking or vortex. Here, ultrasound vortex mixing is utilized to our CLIA platform to remove the non-specific binding and reduce the interference of fibrin clot in serum, and then enhance the accuracy of the result, especially for high-sensitive assays, such as high-sensitivity troponin I. Regarding to medium labs, I would like to share with you the latest standalone unit, CL2600i, with the same throughput of CL2000i, but very small footprint, less than 1 square meter. It also uses SF sampling technology. Besides, there is a network of 85 sensor groups which are monitoring the whole process of testing of the analyzer, from sampling to the measurement, in order to ensure excellent performance. Actually, we pay attention to every segment. So except for solution to the central lab and the medium, big labs, we also have solutions for small labs as well. The benchtop size analyzers, which are compact but effective. CL900i is the star product launched in 2018. It's maintenance-free and cost reductive. CL1000i with bigger capacity for sample and reagent, user-friendly and powerful. With all these different solutions, we can benefit all customers with different needs. Okay, for the second session, I would like to share with you the core competitiveness of Mindray Immunoassay from the voice of our customers and R&D investment as well. Next, let's move to the main focus, Mindray CLIA solutions and innovations to show you a full picture of what we have and what kind of solutions and innovations we can bring to your lab. Okay, up to now, totally we have 89 assays in our test menu, including 16 panels, which we can provide to our customers. And we are expecting another 10 new parameters within this year, which are highlighted in red. Then totally the number can reach around 100. Let me give some detailed introduction on some star panels. Okay. When we refer cardiac panel, we are emphasizing more on raw materials. So after the successful integration of high test, we are trying to enhance the raw material innovation, expand the test menu, keep improving reagent quality. Cardiac panel is the blood test that can provide valuable information for doctors to diagnose and treat heart conditions. It is the first star panel construction fruit after high test acquisition. This year, we launched the high sensitivity troponin I and NT-proBNP, and we are expecting another new parameter, ST2. So when we talk about the whole target structure and antigen structure, firstly, we should know the potential targeted molecules. And we could detect in the blood circulation in a myocardial infarction patient. Actually, high test found out that over 90% troponin I are troponin IC and troponin ITC complex. So detect the troponin IC and troponin ITC complex can effectively avoid false negativity, then improve accuracy. And also, we use IC monoclonal antibody design to improve IC sensitivity and specificity. For the analytical sensitivity of Mindray high sensitivity troponin I listed in this table, the actual performance is much better than we announced in the IFU and better than that of our competitors as well. The overall detection rate in healthy people population between LOD to the 99th percentile, 99% of males and 87% of females, which meet the recommendation of AACC and IFCC guidelines. Furthermore, in the face of real scenarios, we conducted continuously research in 6 hospitals and all scenarios. Among nearly 14,000 samples, and our overall anti-interference probability is less than 0.01. Besides, we carried out some evaluations both in China and in the US. The slide shows that evaluations in the US, the results have been exhibited on AACC 2023, which is conducted in Minneapolis the USA to verify the analytical performance of Mindray high-sensitivity troponin I immunoassay. And Professor Fred Apple, who is one of the most famous experts on heart disease, gave a very positive comment on the analytical performance of Mindray high-sensitivity troponin I. The second evaluation is at Wuhan Asian Heart Hospital in China. The scientific paper is available online, and the conclusion of the study is Mindray high-sensitivity troponin I satisfies the definition of high-sensitivity troponin. It delivers excellent precision, sensitivity, and specificity, and it demonstrated excellent performance in clinical diagnosis, providing high level of accuracy and safety. Another study is from Professor Lippi at University Hospital Verona in Italy. And the conclusion of the study is Mindray high-sensitivity troponin I immunoassay on CL1200I demonstrated that the overall performance is comparable to that of other commercial available high-sensitivity troponin I techniques, making it a viable alternative to other methods. I also want to share some ongoing clinical studies with you, which are doing we are doing the research on 0-2-hour algorithm for rapid diagnosis in China, the US, the US, and Italy. Meanwhile, we are conducting a clinical study on risk stratification of cardiovascular events in special populations. Moreover, we are trying to establish pediatric reference ranges for Mindray high-sensitivity troponin in China. Besides cardiac panel, there is another star panel about inflammation with PCT, which has higher specificity, interleukin-6, which has higher sensitivity, and the CD14ST, which is unique and has both high sensitivity and specificity. With giant detection, it can greatly increase the detection rate. From scientific paper published in May, in this slide, the doctor did the study by using our inflammation parameters. This study aimed to investigate whether changes in CD14ST, procalcitonin, high sensitivity C reaction protein, and interleukin-6 level predict mortality in a septic patient in the intensive care unit. Finally, they found only CD14ST increased after 72 hours of the patient admission, which can help the doctors to define the cutoff for the patient prognosis. And another study on the same topic is ongoing in Spain. Speaking back to the routine test, one we call thyroid total solution, as we provide not only the regular tests used for thyroid function evaluation, but also the etiology of thyroid cancers and the thyroid sick syndrome. Given that serological testing characteristics may be significantly different in different populations, so different reference intervals were established and provided to benefit clinical practice. So we also have a comprehensive panel for infectious disease as well, like TORCH, hepatitis B and C, with hepatitis A and E on the way, the fourth generation HIV with type 1 and 2 HIV antibodies, and P24 antigen, anti-TP for syphilis. All of them are CE approval, with the evaluation performed in German Red Cross Blood Donation Center. Here, I would like to share some key features about HBsAg of hepatitis B. Our HBsAg test can detect 29 mutants, including some complicated mutations, such as drug resistance mutations and vaccine escape mutations. In 2021, we successfully made a big breakthrough in Indonesia blood bank after a long-term evaluation. Now we are doing clinical evaluations in blood banks in different countries, such as Thailand, Angola, and Algeria. Besides, there are several scientific papers are published with very good performance of infectious disease parameters. There are 22 regular and special markers in the tumor marker panel. They can aid in diagnosis and monitoring of many highly prevalent cancers in men and women. Although serological testing cannot replace the clinical practice of histology and imaging, but as they are non-invasive, easy to use, and they are widely applied to assist the diagnosis, treatment monitoring, and the prognosis. During the past few years, we have been focusing on clinical studies. A multi-center study has been done in China. The project lasted over 2 years, and finally, a Chinese expert consensus and 2 scientific papers on lung cancer were published. So here, I would like to make a small summary. We have different modules for different size labs, from benchtop, standalone, and integration, and TLA system, to standardize the process, operation, and the construction of your lab. Meanwhile, the 4 task menu to empower the clear total solution. Okay, that's all my presentation. Thank you for your attention.